So I want to the focus is the risk of the colon cancer. What causes the colon cancer? Is there anything that we can change? Or is some of the situation that we may not be able to deal with in that case? Or what are the things that could help us in terms of beating the cancer? And that there was also another study came out of the Scandinavia about questioning the value of the colonoscopy. So you might, some of you might have run into that article somewhere, and so I want to cover that. So clarify a few things. So start with that is how common the colon cancer. Colon cancer is pretty common. It's the third common cancer after the lung and breast cancer, and then for the men, the lung, the prostate, and the lung cancer. So the lifetime risk for any one of us is, 4 out of 100 of us will have colon cancer. So, where do we see the colon cancer? So 20% of them are related to genetic. That means that transmitted from our parents, the cancer gene transmitted from parents down the generation, and then, increase the risk of the colon cancer. And the other 70% are not genetic. So basically it's all acquired. So or in other words, environmental, or our habits, personal habits, causing the cancer, diet and other things. So the other 10%, if you can see, that is missing. So those, we see that, so probably those are going to be the genetic, but we don't know what the genetic information behind it. So in other words, those are accumulated in the family members, but we don't have the particular genetic mutation that identify yet. So genetic, there's nothing much we can do about it if we have it, and then we have to deal with it. So I want to focus on the non-genetic. That's where we can do something to help improve our chances. So among the non-genetic, there are the other conditions are something that we think that genetically linked, but not transmittable from one person to another, or transmittable from parents to the child. So people with the ulcerative colitis, those, they could be familial, but not necessarily transmittable from parents to the children. And those are the increased chance of the colon cancer. So the cystic fibrosis, that's also somewhat related to genetic, but not the cancer causing genetic, but some other genetic condition causing that cystic fibrosis also increases the cancer of the colon cancer. So radiation exposure, and the main thing I want to focus is the other 5 factors. So the obesity, low lean body mass, and the high fat content, that increases the colon cancer risk by about 23%. So if we try to manage our diet and activity, and then keep our lean body mass at the healthy state, then that will decrease the colon cancer by 23% chance. But the biggest is diabetes. So diabetes, when we're talking about, is type 1 and type 2 both. So basically, high blood sugar increases the colon cancer risk by whopping 40%. And the other is the diet. So you can see that processed food, red meat, they increases the colon cancer risk. On the other hand, eating vegetables, fish, and they reduces the colon cancer risk. Smoking also increases the colon cancer risk, and alcohol also increases the colon cancer risk. So with the alcohol, when they try to do is 4 more drinks a day, so most of us don't do that. But that's where we see the clear increase in the risk of the colon cancer. Then the next is where are we right now with the colon cancer? So unfortunately, right now, by the time that one of us are going to be diagnosed with colon cancer, we are finding it at the late or advanced stage. So if you look at it, so this is the percentage. This is the percentage, and these are the different stages. So We only find the colon cancer at the early stage, 30%. 70% of the diagnosis at the time of diagnosis stages are already quite advanced. So regional means that the lymph nodes are already involved. Localized means that colon cancer is still inside the colon, has not spread to the lymph node, has not spread to any other places yet. So when we see the advanced, the yellow, that means that colon cancer is spreading to other organs like liver, lungs, bones, and everywhere else in the body. So I just looked at the CDC and the Census Bureau data, and this is our San Luis County data. And then San Luis County, we're doing better. About 45% are diagnosed as the early stage localized, but still 25% regional and 25% advanced stage of disease. So why it is important? The next slide is going to help us answer that. So if it is localized, you can see 90% of the cancer are going to be cured. If it is regional, when the lymph nodes are involved, the chance of cure went down to 70%. And also, when you have a regional colon cancer, we're going to need chemotherapy. We're not going to get 70% without chemotherapy. Without chemotherapy, it's only about 40%. With chemotherapy, improved to about 70%. With localized, you don't need chemotherapy, just surgery alone. And sometimes just the endoscopic resection of the cancer alone, we can get 90% chance of the cure. When it is spread to the other location, the chance of surviving 5 years is only 12.5%. That's with the continuous treatment with chemotherapy and some form of the therapy. So it is really important for us to find that the cancer at the early stage. So how are we going to do that? So here are I will focus the screening part, and then I'll go back to the prevention part a little bit. So screening is we have two screening levels for the colon cancer. For example, lung cancer, we don't have much, only have one level. So in the lung cancer, by the time that we, get the something growing, already cancer. But in the colon cancer, a lot of the time started from the non-cancerous polyp, transformed into cancer later. So if we find the polyp first and removed it, hold on one second, let me close the door. Sorry, I thought everybody was gone already. So if we remove the polyp before it turned into cancer, then cancer would not even develop in the first place. In that case, we call it a primary prevention, preventing it from cancer even developing. And that's where this, different screening methods are going to be important to understand. So I listed the 4 most commonly used available screening test. The most common is the colonoscopy. So colonoscopy uses a direct visualization. That means like the camera with the scope looking for any changes, and then help us find the precancerous lesion or cancer. So 94% sensitivity means that if there is a cancer or precancerous lesion there, 94% of the time colonoscopy will find it. And the key part of that is the colonoscopy could be the primary prevention, because when they see the polyp, when they look in the scope, they remove it, that basically eliminating the chance of cancer developing later on. So colonoscopy consider what we consider the gold standard, the best method of the screening test. The second method available, but some of the insurance not fully covering it, which is a CT scan, or sometimes it's called a virtual colonoscopy. In that case, there is no scope involved, no procedure involved. The CT scan, the computerized regenerate the picture so that it's almost like you're looking directly with the camera, but in that case, no camera involved. So that is also pretty good. 89%, that can also detect cancerous lesion and also precancerous lesions. So the other one is the newer one, and then becoming more and more popular because it doesn't require any preparation. The first two tests, the screening test, colonoscopy and the CT scan, require some preparation. You have to do bowel preparation for both of them. So you have to fast, or you have to change your diet to liquid diet for a couple of days, and you have to take something to make you, clean up your bowels. A lot of the diarrhea, a lot of the a couple of days of the difficult time. So with the third method, with the stool DNA, you don't have to do anything. You just go about your normal life. So that's kind of like gaining popularity. So in that case, what they're looking for is the cancer-related DNA in the stool. And then if they are present, that will alert whoever is the person's finding those cancer-related DNA wouldn't need to go on and have a colonoscopy at the time. So Cologuard is good in a way that convenience, but it is not a definitive. But nonetheless, by doing that, we can still find cancer 93% of time, so which is pretty close to colonoscopy. But when it comes to the precancerous lesion, it's only detect 43%, so not as good as the colonoscopy. And also, if the test is positive, we need to do colonoscopy to be able to find and then finalize the what's going on and the diagnosis. So other thing is in a lot of the places where colonoscopy and Cologuard are not widely available, then we do the other test in the stool sample, but in that case, we're not looking for the DNA. We're looking for the remnants of the blood, degenerated blood. And if there is any blood in there, that will prompt to do the full colonoscopy and find where it is coming from. So those are also more effective than not doing any screening test at all. In that case, 74% with the FIT. In that case, they uses some immunological process to find the trace amount of the blood in the stool. The other one is a chemical, using the chemical to find the trace amount. So using the immunological test, it's a little bit more effective finding the blood in the stool. If there is 74% time, it will find it if there is a blood in there. And the chemical testing only find about 50% of the time. So, that's so basically the colonoscopy and Cologuard, I would say that they are the two reliable methods, but the key differentiation is if we want to do the primary prevention, even finding it before cancer developing, colonoscopy is the only way to do it. So, so going back to that, and then so if we do that, if we find it, then this is the benefit of it. We find the early stage cancer, and then even though if we are able to find the precancerous lesion, remove it with the endoscopy, that's 100% cure rate because cancer never develops. Even cancer develops and then we find it, with the surgery, we can still cure it 90%. So basically, colonoscopy benefit is 90 to 100%. So, that's where we are for especially with the people who has the underlying health condition and genetic predisposition, likely going to have a colon cancer. There is nothing we can do about it. Then those other people should have the screening procedure followed religiously, because that's the only way they're going to be able to prevent the death from colon cancer. So for the other people, who doesn't have the genetic predisposition or other predisposing the diagnosis like diabetes or ulcerative colitis or inflammatory bowel disease, then there are other ways that we can cut down the risk, and that would be considered as a primary prevention because we're preventing the colon cancer from developing in the first place. So such as that, physical activity, So 5 med hours of activity a week reduces the colon cancer by 20%. So 5 med hour a week is basically about walking, 1 hour, 15 minutes every week, rapid pace. It's about 3 miles per hour pace. If we walk about 1 hour, 15 minutes every week, there's a 20% reduction in the colon cancer risk. Then the diet, pesco vegetarian diet, it's a Mediterranean diet. That's what they call it. Fish, vegetable. That reduces the colon cancer risk too. And the other is calcium. If our diet has a low calcium, and that increases the colon cancer, high calcium. So that's why that you will see some of the initial literature. Oh, vitamin D is, the preventative for the colon cancer. And that probably related to the calcium and vitamin, because you need calcium to be absorbed. You need the vitamin D for the calcium to be absorbed. So I will put that calcium and vitamin together in that category. So diet with the high risk, high calcium, high vitamin D, vegetarian, fish, the pesco vegetarian diet, physical activity. Those are the other way of preventing the colon cancer. So having said that, the colon cancer reduces can be detected up to 94% of the time. And then early detection is going to prevent us from dying from colon cancer 90 to 100% of the time. So, basically if we're finding anytime we see the advanced colon cancer, that means that we're not really doing and utilizing what's available for us. So, with the colon cancer, the month, I think that would be my first most important message to everybody. Try to prevent as much as with the diet activity, but what some of us are unlikely to be exposed to the high risk, and we cannot do anything about it. Then the screenings are very important. So that moves to the trial that I was talking about, Nordic trial, that was published in the New England Journal of Medicine in October 2022. The study was done in the Scandinavian countries. And then, believe it or not, no other country besides United States recommends colonoscopy routinely as a screening for colon cancer. They only do it when there are other symptoms of problem. So for them to adopt a colonoscopy as the screening test like mammogram, they run this study. So they have that, the predetermined population. They divide into groups. One group, they offer colonoscopy as a screening test like we're doing here. The other half, they don't do it. They just go through just routine and only will do colonoscopy when they have a problem, bowel problem. So then they compare those two groups, see there is any benefit from in the group doing the screening colonoscopy. And they didn't find a significant improvement in the cancer detection or the colon cancer related death. So they published it, and then they said colonoscopy is not as useful as we considered it to be. But when you actually, so that was a newspaper wrote about it, and then, whether colonoscopy was actually beneficial. So a lot of debate. So, but the real issue is not about the colonoscopy. The real issue in this study is in the group of the people supposed to have colonoscopy, only 42% follow through and have the colonoscopy because it's not compulsory. It is voluntary. So like everything else, we're finding here in United States, when it comes to colonoscopy, everybody shrinks like a, earthworm. We don't want to do it. So in Scandinavia, the same thing. Even though they are offered in the study, only 42% pick it up. So because of that, the benefit markedly decreased. And nonetheless, when we compare it, there's an 18% reduction in the colon cancer in the screening group nonetheless, but it was considered below what we, been the promoting. So that was a debate about whether colonoscopy was as effective as we are promoting. But it turned out the study has a flaw. So one of the response backed by the experts in the colon cancer was that yes, colonoscopy to work, you have to do colonoscopy. Just offering the colonoscopy is not really doing the colonoscopy. So if you run into that and somebody argue with you, and that's the reason that the study was not finding the effectiveness in the colon cancer prevention.